So I kind of wanted to go through some of the top warning signs that your pet may have cancer. This is to educate, not to freak ourselves out, because a lot of other illnesses can also cause similar signs. But again, these would be reasons that you would want to think about going to your veterinarian. So I'm going to start with a story of a cat named Jeter who presented to internal medicine as a 10-year-old kitty. In December of 2010, he presented for vomiting. The owners were not sure if he was eating well, but he had lost 3 pounds. The owner reported that he lost 3 pounds because the mother-in-law came in for Thanksgiving, see this was in December, and noticed that the cat looked thin. The owner said, oh, okay, went to the vet. Vet said it lost weight, it came to medicine. He had a normal exam, he had normal blood work, they did a maldigestion profile to see if that was the reason he was losing weight. Normal ultrasound, but it was decided that this cat had lost a lot of weight, and he was taken to surgery, laparoscopy. So not a big surgery, that's where they put in these scope cameras to get biopsies. So he had mottled liver, his lymph nodes looked big, but his intestines looked good, but everything was biopsied. Turned out that he had inflammatory bowel disease. So the internist recommended that he was treated with steroids, started with twice a day, then it was backed off to once a day, and then every other day. They changed his diet to a novel protein diet, because we know that that can often be one of the causes for inflammatory bowel disease. And he improved clinically, he gained weight, first a ½ pound, and then another pound. And then the owners called in and said his vomiting increased, but they weren't sure if his appetite was good because there was another cat in the household. And the internist said, well, maybe we should increase the steroids. And then I'm in the kitchen, and this cat comes walking by and he goes, meow, meow. Yeah, Jeter's my pet. Listen, I mentioned that earlier. He lost 3 pounds. I'm married to a veterinarian, and it took my mother-in-law coming into town to notice. You guys don't think I'm a good vet anymore. No, I'm an average pet owner. That's what I am. So then Raz, so Jeter was my cat on the Yankee fan. We got them during our residencies, and Raz was his cat. So I go, and so Raz is in the kitchen going, meow. He can't lift his neck. I go, honey, something's wrong with your cat. He goes, nothing is wrong with my cat. And he walks in, and Raz is like, meow. He goes, oh my God, something's wrong with my cat. So we bring him in, and his potassium was crazy, crazy low. Turns out that he was in kidney failure, this weird type of kidney failure called renal tubular acidosis. So his potassium was so low that his muscles were weak, and he couldn't lift his neck, and he was anemic, and he needed blood transfusions. And he did well for a while, and then we had to euthanize him. Heartbreaking. So we had to explain to the kids. You know what we realized after he was euthanized? There was no more vomiting in the house. The original vomiting was Jeter. He did have inflammatory bowel disease. But the recent increase in vomiting that we got with Jeter was Raz and his kidney disease. I bring this up, guys. It is really hard when we have multiple pets in our house, or even one pet, to always know. It's really hard to notice if our pets are losing weight. So these are things that we need to get our veterinarians involved. We need to do regular visits. Now, 5 years later, he's the only cat in the house. It's just him and Matilda. He's vomiting. He was losing weight. He wasn't eating well. We worked him up again. We added oral chemotherapy. This was at one point a 10-plus pound kitty, 13-pound kitty. Added chemo. He lost more weight. We added injectable chemo. You can see everybody loved him, even though he was a horrible patient. He was the nicest cat. Stacy knows him. But he was an evil patient. And you'll see, because when he got chemo, he needed a mess. So we gave him chemotherapy. I couldn't get this cat to eat, guys. How frustrating is it when your cat won't eat, right? So then we gave him chemo, and there were days like
How was your chemo treatment? Was it good? Is that good snacky snacks? Don't talk to me now. Ooh, that's good.
Oh, I was so happy when this cat would eat. I was like, it's working, it's working. And then most days were like this. We call this the kitty buffet. Open up every can we have in the hospital and see what he'll eat. But then don't buy too many of those, because you won't eat them for long, right? But this is how frustrating it is as a pet owner when you can't get your pet to eat. We tried all the different medications that we had at our disposal. We tried acupuncture, we tried his steroids, they still didn't help. So this is after one of the strongest chemo drugs, doxorubicin. We were treating him for lymphoma, and he's sitting on the couch with my son, and this is the week that we euthanized him. It was really hard to make that decision, because just when I thought, he would start eating again, then he would stop eating again, and it was really quite a roller coaster. His appetite was really inconsistent, and I, as a veterinarian, and my husband, when is the right time? Quality of life is so hard. It's a term we talk about in veterinary medicine, but it's really hard to figure out. So we eventually euthanized him. So again, a lot of the stuff that I'm going to talk about in the top 10 guys, I know how hard it is. We really, really do. But I'm hopeful that we can educate ourselves and all do better. All right, so the first one is changes in appetite. Is your dog or cat eating more than usual? Who has more than one pet in the house? Right? It's really hard. Our cats were free choice kitties. So, and one of them, tended to eat the other one. So sometimes it was really hard to figure out who's eating how much food. Are they eating more or less than normal? And sometimes it's really confusing because they'll eat your food, right? They'll eat chicken, they'll eat human food. And you'll go, oh, well, their appetite's okay. But if they're not eating foods they've previously been interested in, something could be brewing underneath. And again, drastic changes could be a sign, not just of cancer, it could be other diseases as well. So it's really a good indication that it's time to get our pet to the veterinarian for a workup. So just so you know the joy that I have when it's feeding time. So I'm lucky my boys help in the process. There's often a little pool of drool. So I'm lucky now my sons will actually feed the boys. Penelope has no manners. I blame her father.
Leave it.
As my son. They're happy dogs. So again, this is the joy that we have with our pets. So again, these are things to look at. Told you I'm a crazy pet owner. Happy dogs. All right. And when our pets are not eating, it can really be a big quality of life issue for us. And I think it's a really important thing to keep track of, especially again in these, I think with cats in a multi-cat household, it's much harder. So more than 10 million dogs, there's been a recent study presented to their vet annually for just the symptom of inappetence. It could be the first sign and the only sign that something is wrong with a dog or a cat. And the thing is, almost any disease can cause decreases in appetite, complete anorexia, which is more obvious, or changes in appetite. They're not eating the things that they normally ate. And left untreated, that can actually sometimes be worse than the underlying disease. And we really know that there are so many metabolic changes that go on when our pets aren't getting the nutrition that they need. So the obvious one is that they're decreasing food consumption, right? Weight loss. Big fluffy pets, it's really hard to tell, guys. It's really important that we're weighing our pets regularly, and so that usually means going to a vet. And I know that most vets will be more than happy for you to pop in and get your pets on the scale, dog or cat. Muscle wasting, again, can you feel your pet's ribs that you couldn't? Can you feel their spine and things like that? Again, I think in fluffy animals, it's really important to know what their normal is so we can keep track of it. Sometimes if they're not interested in their eating, they'll smack their lips. That could be a sign of poor appetite or a poor hair coat. And so that would be something that we want to look for. And changes in normal behavior. But the problem is these signs are not really obvious in most of our pets. So it's really hard to recognize these. So what causes inappetence? It's a lot, guys. Could be nausea and vomiting, which is usually due to another underlying disease, maybe cancer, maybe kidney disease. Ulcers can cause it. Constipation. So if your dog or cat is constipated, they're not going to be wanting to eat. Chemo, pain medications, guys, especially the opioids. If your dog's on tramadol after surgery, that's going to change their appetites. A lot of the non-steroidal inflammatories. Anybody's pet ever been on Deramax or Rimadyl, carprofen, those can cause changes in appetite. Cancer can cause it, so that's something I worry about. Pain can cause it itself. Kidney disease, respiratory disease, neurologic disease. Cats with cancer in their nose, dogs with nasal cancer. If they can't smell, they're not going to want to eat. Mouth diseases, the pain from it, or actually the physical mass blocking, that can make it difficult. Sometimes neuromuscular diseases affect their muscles in their face and they just can't physically able to, chew their food. Unpalatable diet. Who puts medications in their pets? I do. Matilda's heart medication goes in, and Penelope's Addison's medication goes in, but they eat their food all the time. There's lots of medications. Anyone ever had their dog or cat on metronidazole, the diarrhea medication? Bitter as crap. Don't put that one in, because they start tasting that, they're not going to eat it. So that's when they want to wrap in peanut butter or a hot dog or something like that. But if you start putting medications that taste bad into their food, that can make them not want to eat, and then they can get food aversion. So this was one of my nurse's dogs, and just had surgery. So pugs often have their, nasal passages are kind of closed, so we just had surgery to open up his nose. And this dog, he has a lot of rolls. Charlie loves to eat. Charlie does not miss a meal. And Suzanne is texting me, Charlie won't eat after surgery. This is what he's doing. Charlie does not miss a meal. Mom! So what does Suzanne do? She takes the food and dumps it on the floor. I think his nose was like hitting the bowl. I never thought of that. But again, so, pain can cause it. There are all these things that can cause it. So sometimes we have to get creative, and sometimes we need to go to the vet. So it's really distressing when our pets won't eat. We often think our pet is suffering. I told you with Jeter, I'd be like, I think we're going to use them. And then he would eat. I'm like, no, not today. Today's a good day. So it can really be, a big quality of life issue. And then for the pet, they can lose weight. They can lose muscle. They can really become very frail. And as you'll see on the next slide, there are studies that show all these negative things on the body. It decreases quality of life. In cancer patients, can decrease survival. Same thing with kidney disease. It affects their immune response. It affects wound healing, their musculoskeletal strength. If you have a dog that has arthritis and then they start losing muscle, that's going to make it harder for them to get around. So it's really important that we address inappetence early. Chronic weight loss or weight gain. Again, if there hasn't been a change in their food or their diet, but your pet is losing, and we're going to mostly focus on losing weight, it could be a sign of disease. So we have to weigh our pet regularly. And so again, it could be for your cat, you weigh yourself, get on the scale, weigh them, and subtract the difference. They're not that expensive. You can buy a children's pediatric scale on Amazon. If you have a cat, you want to keep a track of their weight. Or if you have a dog and you don't want to do that, I'm sure your vet would be more than happy for you to go in and weigh your dog on a regular basis. And another related symptom that could be associated with this would be chronic vomiting or chronic diarrhea. And so this is one that I get a little bit on my soapbox for, because a lot of us think that vomiting is normal in cats, right? They just eat too fast. He's always done this. Long-haired kitties, they just have hairballs. They have a sensitive stomach, and they're just a nervous cat. And there's a study that's listed on the bottom that looked at 100 cats that had chronic vomiting or weight loss or diarrhea for certain criteria. And then if they had an abnormal ultrasound, 99 of those 100 kitties that went to surgery had inflammatory bowel disease or lymphoma of their intestinal tract. So it's really important that we are identifying vomiting, weight loss, and diarrhea, especially in cats, because it often indicates underlying disease. So again, and I think, even us as veterinarians, it's just sort of like, vomiting in cats is normal, but it really, really isn't. So it's really important that we stop making excuses for the vomiting cat. They're just hairballs, plants, things like that. Again, I find that we make too many excuses. Because we've done the other talk, I'm not going to spend too much time talking about this, but you guys now know, right? Mass is the size of a pea, or been there a month. We are going to be proactive, and we're going to go to our veterinarian and get an aspirate, because we do not want to see these dogs anymore, and cats, right? The last one is what we want to see. Nice, small, little masses. That was a mast cell tumor that its first surgery was big. And they got clean and wide margins. So again, see something, do something, why wait, aspirate. Do you guys know all this? Okay. All right. So I do want to touch on, because we're talking about lumps and bumps with mammary masses in dogs and cats, because they're one of the most common cancers that we see in dogs, and they're definitely a little bit different in dogs and cats. So in dogs, 50% of dogs that have mammary masses are benign, 50% are malignant, and half of the malignant ones will be cured with surgery. So that means 75% of dogs and cats that have breast cancer will be cured with surgery alone, but find having them small is super, super important. Very different than cats. In cats, 80 to 90% are malignant. And in cats, the recommendation is that the whole chain comes off. So it's very different. In dogs, we're just gonna do a lumpectomy. We're just gonna remove the mass. But in cats, they need to have a radical mastectomy. 50% of dogs and cats will have multiple mammary masses when they have their first one at the same time. Dogs have 10 mammary masses, mammary glands, and cats have 8, going from here to here. So it's really important that if you're a veterinarian or you find a mammary mass in a dog or cat, that the entire mammary glands all get felt. And again, the surgery, like I said, is very different. Cats require very aggressive surgery. Dogs just, you want to be able to remove the mass. So again, early detection is critical. Size matters. When you're feeling your dogs and cats, that is monthly exams. You want to make sure you're feeling their mammary glands as well. Can male dogs and cats get mammary cancer? They can. Really uncommon, about 1 to 2%. It's also way more aggressive. So again, even if you have a male dog or cat, include that in your monthly exam. Okay, so this is just to remind me to tell you that, so this is a dog that's being prepped for surgery. So this dog had a couple of different masses, so that's why the surgeon's doing a nice big one. But again, look, multiple masses, so also taking off on this side. They come in all different shapes and sizes. Sometimes once you shave them, you really see them extending beyond the mass that you could feel. And again, a big ulcerated, nasty mess. So lymph nodes for lymphoma are another thing that people want to know, where are my dog's lymph nodes? So I made this little video. Hi everyone, I just wanted to do a quick demonstration of where dogs' lymph nodes are. So one of the questions that we've been getting as we've been focusing recently on lymphoma is, where are my dog's lymph nodes? And so most dogs, I can feel their lymph nodes, but they're not super easy to feel. But Remington is one of our favorite patients who has lymphoma. He's recently relapsed, so his lymph nodes are big, but he's still very, very happy. Very, very happy. Are you a good boy? Yes, he's a good boy. So we're going to show everybody where your lymph nodes are. Okay. So they have 2 under the jaw. They're called the mandibular lymph nodes. And you can feel them right here. You can see them. They're kind of like a cluster of grapes. And then on the right side, pull back his ear, you silly dog. So here, oh, you're so silly. That doesn't hurt. That doesn't hurt. Is it your ears? You don't want your ears touched? Okay. And then the prescapular lymph nodes are in front of the scapular bone. So these are here. So you can see them kind of blipping here. So they're right here. And again, on this side, he has one here as well. So mandibular, under the mandible, which is the lower jaw. The prescapular, in front of the scapula, which is in front of the shoulders. And then the popliteal lymph nodes are behind the knee. So this is the knee in the dog, and his popliteal lymph nodes are actually super normal. So they're about the size of like a lima bean. So I'm just flipping them through my hand, but these are very normal. And then we're gonna lay you down, handsome. Ready? Like that way. 1, 2, 3. Oh, good boy. His inguinal lymph nodes are up, and those are in the inner thigh. So these are in here, and they're right here, and then slide it over. His other inguinal lymph node is right here. So normally when a dog comes in and they relapse for lymphoma, we'll measure those lymph nodes, which we already did and documented in his record. So those are what we call the peripheral lymph nodes. Again, in dogs, you can feel them even when they're normal, and his are obviously big. Cats, it's really hard to feel their lymph nodes, even on a normal day. And so that's about it. Thank you, Remy, for being our demo. Are you exhausted? Are you exhausted? Are you ready to go? Ready to go see your mama? Thank you. Thank you for being so perfect. We love you. And everyone, this is Steph, my assistant. Okay. All right, so the 4th sign, we talked about changes in appetite, chronic weight loss, talked about enlarged bumps. Again, we talked about skin lumps, we talked about mammary masses, and we talked about lymph nodes. Those are all the lumps and bumps I want you to be feeling for. This really ties together, but is often separated. So sores that don't heal can be anything. So again, you just want to feel them and bring them to your vet. This is a mammary mass. This is that cat with the injection site sarcoma. This was a mast cell tumor in a pug in between his toes. That was a bloody mess. And this is another dog with a very aggressive, actually a mast cell tumor in the mammary gland area. So again, that would be another reason if they're not healing, you would want to bring them to your veterinarian and see if it's an infection or see if it's cancer. So another common cancer that I wanted to touch on, because one of the signs is persistent lameness or stiffness. This is gonna be tough, right? Lots of our pets, as they get older, they get arthritis. And so that's gonna be something that we can manage with pain medications and other things that you're gonna talk to your veterinarian. But one of the other ones that we need to be aware of is osteosarcoma. So that is primary bone cancer. 85% of dogs that have bone cancer have osteosarcoma, and it's estimated to be about 5% of all cancers. There are certain breeds that are high risk, so that's why we're gonna talk about it. This is a cancer that when I talked to pet owners, I said there's two battlefronts. Remember for Smokey, we just needed a big surgery, but it had a low chance of spreading, so we didn't talk about chemo. These cancers are really aggressive in the bone. They eat away at the bone, they're very painful, lots of swelling. Only about 3% will come in with a fractured leg, but they also have a really high spread rate. So in addition to doing surgery, we're also gonna be recommending chemo afterwards. And so 90% of dogs that if they just have surgery will succumb to the cancer spreading to the lungs within the first year. Chemotherapy can really improve those survival times, but again, it's important to find them early. Who gets bone cancer? It's estimated it's probably higher, greater than 10,000 dogs per year get bone cancer. Tends to be middle-aged and older dogs. Tends to be a disease of larger dogs. Larger dogs have shorter lifespans, so that's why 7 to 9, you're like, well, that's not really that old, but for these large and giant breed dogs, that's considered middle-aged and older. It has also been reported in young dogs as well, and we do see a second peak incidence of dogs about 1.5 to 2 years of age. So again, it's one that I want you to have your radars up. The rib location we see a little bit younger. I'm breedist. I'm the kind of person you don't want to have a dinner party or go to the dog park, because I see certain breeds and my mind jumps out certain cancers. And so this tends to be one that we see in large and giant breed dogs: Great Danes, St. Bernards, German Shepherds, Dobermans, Goldens, Rotties, Greyhounds as well. What's more important than the breed is the size of the dog. So again, these large and giant breed dogs, these tall dogs tend to be predisposed. But again, we see it in other breeds as well, and you can also see it in the non-leg bones, so not the limbs. You can see it in like the spinal bones and things like that, the ribs, and that will be any breed, not just the large and giant breed dogs. This is to remind me to tell you, this is Emma. I'm currently treating her for osteosarcoma of her pelvis. She's not a large and giant breed dog. No, she's not. So she just finished palliative radiation and chemotherapy, and she's as cute as pie. But again, so other dogs can get it as well, so that's why we want to know the signs. In this middle video, this is Bella. She's a dog whose owners decided not to do an amputation and chemotherapy, and she just had palliative radiation to help control her bone pain. And she was really, really lame when she first came in, and Mom was really excited. She shared this video with me. You can see it's her left front leg, but she was really pleased because now she was finally going on walks.
This way. Bella. This way, honey.
She's kind of getting along pretty well, right? And this was about halfway through radiation, and she is getting chemo as well. And then at her appointment this week, Mom said, look at this. So again, not everybody's going to do amputation, not everybody's going to do chemotherapy, but there are options, and that's the point of what I do, is to give different families different options for what they want to do. And so again, really, really pleased with Bella's progress. And I taught Mom how to airdrop those videos to me, so she was super excited about that. Okay, so where do we see these? So for bone cancer, again, 75% of it are in the long bone, towards the knee, away from the elbow. What do we mean by that? So usually it's the end of the femur bone and the top of this bone, which is called the tibia. So again, towards the knee, and our dogs also see it at the hock or the ankle as well, and away from the elbow. So the top of the humerus bone and the end of this bone right by the wrist, called the distal radius. Those are the most common locations: towards the knee, away from the elbow, and the hock, which is the ankle. Tend to see it more commonly in the front leg than the back legs, and again, these are the most common locations, the ones in the front legs: the radius, which is by the wrist, and the proximal humerus, which is by the shoulder. And the back leg, it's an even distribution. Tend not to see it in the distal or beyond the wrist and the ankle or the hock. Very uncommon. I just saw one when I was in the Hudson Valley area, and I think that was the first one I had seen in about 10 years. What do we see? usually you're gonna see swelling. The ones that are by the wrist and the front legs of dogs, usually easier to see, especially if you have a smooth-coated dog, right? The shoulder ones are really hard, guys, especially if you have a big fluffy dog. So again, part of when you're feeling your dogs for lumps and bumps and any changes, you wanna feel those areas. What do we typically see? They're lame, there could be swelling. Not many dogs will break their leg because of the destruction to the bone, but it is traumatic because you're gonna have to make a decision pretty quickly about what to do for these dogs. This is where I get on my soapbox again. If you have a large and giant breed dog and they have swelling at the sites that we talked about, go to your veterinarian and get x-rays that day. The problem that we see is that x-rays are often delayed. They go home on pain medications, and what happens for a couple weeks? They get better, right? Because the pain medications help. You're covering up the pain. So again, if you decide to be a little more conservative and take the pain medications, I want you to go back to your vet in a week or two, especially if there's still persistent pain. You should be getting x-rays early, and early detection is really, really important. This is a video of Dylan, who I saw when I was in the Hudson Valley. Go, Dylan, go! He was a Highland amputation. He lived, I think, 2 years and 4 months with his osteosarcoma. This is one of my favorite, this client when I was in the Hudson Valley. So this is Mangus, and this is Mateo, his brother, and she would send me these pictures and post them on my Facebook. So he's my hero, 6-month survivor. She took holidays very seriously there. My favorite was May 5th. Mateo was wearing a mustache. So.
I didn't even recognize him. The mustache on.
Yeah, I know. Okay, so number 6, unpleasant smell from the mouth. So guys, oral cancer is estimated to be the 4th most common cancer in dogs. And how many of us are sticking our hands in our dog's or cat's mouth? No. Oh, well good, you should be. But again, also depends on the temperament. Really good if you have puppies and kittens to get them used to opening up their mouth. But again, what we want is there a foul smell? People often say, oh, it's just the teeth need to be clean, but that can often be a sign of oral cancer. This was a dog that actually had lymphoma of the lips. Not all pets that have oral cancer exhibit pain. That's an important thing. And sometimes they don't even have trouble eating. So if you have that foul smell, you want to go to the veterinarian. To be honest, guys, to do a good oral exam, most of the time it requires sedation in most pets. So expect that. I think about when I go to the dentist and they grab my tongue with gauze and they're lifting everything around. We can't do that. We can't lift a dog, move their tongue around. So usually it's going to be a sedated oral exam for our pets. But these are just some of the tumors that I've seen. So this is one. This is the roof of a mouth of a dog. This was one on the bottom of the tongue. Yeah, not a great place. So that one was just biopsied. And then we treated that one with just chemo. And then again, this is the roof of the mouth of another dog. So it's really hard to see these tumors. One of my favorite stories is Brogan. And the sad part about Brogan was that he was only 2 years old when he was in the kitchen and mom was giving him a treat and she noticed that. So he was holding up a treat and she saw this big mass. He's not even 2. Brogan, the family got as an anniversary gift for each other, and then Brogan happened to share the birthday with Dad. So there was a lot of connection with this dog, and he was just a wonderful, wonderful German Shepherd. And so this was not a surgical case. I extended him to another facility. He had radiation. It's hard to see, so this is what we started with. The radiation turned his face white, so he kind of looked like a raccoon. But we did make his tumor go away. Originally, I told his owners I didn't have very good options because it was an aggressive tumor in the top of his mouth. We started an oral chemo, we did radiation, he celebrated his 1-year anniversary, he turned 3, he never had spread. His cancer did come back about 1.5 years later. He did have more radiation and chemo, but he lived 23 months. And it's hard when it's a young dog, but this was a dog I wasn't sure that would live 3 months with his cancer. And he had a great quality of life. He would come in, he would jump on the counter, he would knock things off, he would get lots of treats. Most of the time when I was getting pictures, I was laying on the floor with my iPhone and he would swat it across the thing. And I told his mom, I'm like, if he breaks my iPhone, but that was how I often got pictures because we didn't want to sedate him at every time. Guys, that's another great trick for to do oral exams. Are you laying on the floor with your pet or they're panting and the tongue's hanging out of the side? Try to look at their mouth. Turn your phone light on and look around if you can. But it's really important that we're looking in the mouth. It's going to be harder for cats because they don't pant and they don't, do that, but it's really important that it's part of their exam when they're going in is a good oral exam. Difficulty breathing, eating, or swallowing. So a tumor in the mouth or neck can put pressure and make it difficult not only for them to eat or drink, but sometimes breathing as well. So this is a kitty that had nasal lymphoma, so it's kind of displacing his eye off to the side. This cat did not want to eat. Cats are so sensitive to smell. So they have an infection, an upper respiratory infection. Those cats with the runny eyes when they're young, they're not going to want to eat. And if they have a tumor in their nasal passage, dogs as well, but especially cat, is going to make them hard to breathe sometimes and hard to eat as well. This is Maya, one of my favorite cases that I treated this year. Dad came in and her lymph nodes were so big from her lymphoma that her face was all swollen because the lymphatics were being blocked. And so you can see how big her face was. And she was one of these so sweet, this pity. I walked in the room like she felt like crap and she was like, I'm gonna give you a little low wag. She's like, please make me feel better. So we put her on chemo. But that's just a week later. How dramatic. So again, with that swelling of her face and things like that. And again, she didn't want to eat when her lymph nodes were big and her neck was swollen, but she ate very well once we got her into remission. So a couple more to get through before we can do a few questions. So difficulty urinating or defecating. So who lets their dogs out in the yard and doesn't watch them pee or poop? Most of the time, now with Penelope, we don't because she's a little escape artist, but it's okay. But I have to tell you, when I was a resident in New York City people are the most in touch with their pets' urine and pooping behavior because they're walking their dogs on the streets, right? They notice if their poop's different, if there's blood in there, and things like that. So it's really important that we're keeping an eye out. And I know a lot of our pets go in the yards, especially in these cold, snowy days, and we're not going to know. But it's important to keep an eye on their urination and their defecation. To make sure that there's no issues. And if your pet's having trouble, that would be a good indication to go to the vet. So one of my clients is here, and she had noticed that her dog had a lump by his anal area. And so it turned out to be an anal sac tumor. And so Callan, did he finish chemo 2 months ago? Yeah, but again, early detection, mom finding that mass by the butt, did surgery, and finished chemotherapy. So again, really, really important that we're trying to help find these cancers early. So I just want to touch a little on bladder cancer. So bladder cancer, guys, is confusing because the symptoms that we see are the same as a urinary tract infection. So often our pets are going out to urinate and they're straining. They're peeing frequently smaller amounts. Who's ever had a urinary tract infection? Yeah. They hurt and they're uncomfortable and you constantly feel like you have to pee. So that's very similar to what the signs of a dog with bladder cancer is. But the problem is, they often have secondary urinary tract infections. What do I mean? They have urinary infections on top of their cancer. You put them on antibiotics, they get better, but it never completely goes away. So the symptoms are the same as a urinary tract infection, and they often still have a urinary tract infection. So again, if the symptoms aren't going away, that's going to be a great time to get back to your vet and say, do we need to do something else to make sure that my pet doesn't have bladder cancer? So I bring this up because I think this is interesting and this relates to other cancers as well. But Scotties are 19 to 20 times more likely to have this type of bladder cancer called TCC. And they did a study because they're a high-risk breed. And the addition of vegetables decreased the incidence of bladder cancer. Pretty cool. In this study, they had at least 3 times a week, along with their normal diet. It turned out this was a study where they just asked owners about it. Carrots were given the most often. And there was an inverse association. So the more of these green leafy vegetables and yellow orange vegetables, there was a lower chance of getting cancer. And then some of these other vegetables was not significantly associated. And why I think that's really interesting is in people, 2 things that are associated, lifestyle things that are associated with cancer: obesity and a diet low in fruit and vegetables. And so even though this study was only done in bladder cancer, I think it makes sense to be thinking about giving our pets fruits and vegetables. We know the ones to keep away, right? We're not giving raisins, we're not giving grapes, we're not giving onions, no chocolate. You give the chocolate to your vet. But that's not a vegetable, is it? No. But I was just thinking of foods not to give your vet. But again, I think this, or your vet. Your pet! Late. It's past my bedtime. But again, I think that is really interesting, but again, they studied this cancer. So I love to see what fruits and vegetables my dogs will eat. You can't take carrots out of the fridge without them running over. They do love carrots. Matilda will she'll eat romaine lettuce. She will not touch a cucumber. She gets really excited, then she goes to the family room and she's like, oh, Mom, Penelope will eat the cucumbers. But again, so I'm always trying to add extra vegetables to their diets, either as treats or in their food as well. So again, what are the risk factors for bladder cancer? Some of the older flea products have been associated. Obesity. Female dogs are more likely to get it. Treatment with a chemotherapy that we use has possibly been associated. But these are the high-risk breeds, and you can see that Scotties and Westies are the more common ones. Whenever I see a Scottie and Westie, I think bladder cancer. I know it's just my stupid, bias of being a cancer vet. But again, especially if you have these breeds, Beagles, Keesounds, Dalmatians, Westies, Shelties, those would be things that you want to think about and be more aware if they're having these urinary signs. So what can we do to prevent cancer in our pets? And I think this goes to all cancers. Limited exposure to lawn chemicals. And what's interesting is it could be your neighbor's lawn, depending on how close you live to them, which stinks, right? So you can be doing all this minimal stuff using organic products, and then there can be drift. Limited exposure to the older flea products. I think you should be adding vegetables at least 3 times a week, especially for the high-risk breeds. And again, we really want to educate and be suspicious of recurrent urinary tract infections. And if you have a high-risk breed and you have a urinary tract infection, you want to be more proactive about working that up. There are some new tests that we can use for screening. There's a new test called the BRAF test that you can use as a screening test that just came out last year. So that's really exciting as well that we have some other screening tests available.
I have a question.
Yep.
Your high-risk breeds, if
Mhm.
they came in and they have a urinary tract infection, and you happen to be one of those breeds, are you gonna try and get a pipette urine, or are you gonna go in with a needle
So it also depends on the age of the dog, right? So if you have a 1-year-old dog with a urinary tract infection, I'm probably going to be less thinking about bladder cancer than if I have a middle-aged or older dog. So I think you're alluding to the fact that there's concern with getting a urine sample in dogs that have transitional cell carcinoma that you could be seeding it. It's a little bit controversial. So I still think in an animal that you're concerned about a urinary tract infection, it's reasonable to get that urine sample from the bladder sterilely. But you can also do things about like doing an ultrasound, see if there's a bladder mass there or things like that. But I think it's fine that first offense to get it from this sample. And like I said, some of the literature doesn't suggest that that's as big a deal as we think it is. You can put 4 oncologists in the room and probably get 5 different opinions. I'm a Gemini. Bladder cancer in cats is much less common, and urinary tract infections in cats are not as common as well. But they can still get bladder cancer, so I think the rules apply. I don't think they've done those studies with vegetables and cats. Looking at your cookies and corners. We're going to wrap up with bleeding or discharge. So for any opening, so that can be from the top to the bottom. So bleeding is a common sign of cancer, other illness. So we talked about oral cancer can cause the gums to bleed. That's really one of the ways that a lot of my pet owners tell me they found their oral cancer is that they found blood in the water bowl, or they were feeding and they saw blood as well. Nasal cancer can also cause nosebleeds. Other things can cause it too, guys. Fungal diseases, high blood pressure, and things like that. So we're not just thinking about cancer, but again, if your pet has a nosebleed, that would be a good thing to go to the vet. Blood in the urine. When I went to vet school at Cornell in Ithaca, do you know what they said the #1 time that owners found blood in the urine?
Winter.
The first snowfall, right? Yeah, because that's when often we see it, right? It doesn't go right in the ground, or they have an accident in the house. But again, all of these would be great times to go to a veterinarian for workups. Blood in the feces could be something like worms and parasites and things like that. But again, it also could be gastrointestinal cancer or an anal gland mass as well. And then the last one is persistent cough. So again, completeness. Young animals can have kennel cough, right? There could be non-cancerous reasons that we can have a persistent cough for sure. But in our older animals, a drier persistent cough could indicate something near the the air pipes, so like the trachea, right? Or they could have cancer that has spread to the lungs or cancer near the heart. So again, that would be a great reason to go to your veterinarian and get chest radiographs. This is one of my patients that had metastatic cancer, and sadly, a lot of the times, this is the first thing that is found is cough and then cancer that has spread to the lungs, and a lot of times we don't even know where the primary cancer was. So these are some of cases that I've seen over the years. Guys, I include this in a talk that I do for veterinarians. I treated this dog successfully with oral chemotherapy for 10 months, and this dog is Oprah, and she was a dog that I treated for almost 3 years for her cancers. So what often was taught in vet school as no options, there are a lot of options even for dogs with advanced metastatic cancer. So I bring that up. If you are unfortunate enough to find a pet with advanced metastatic cancer, talk to an oncologist, because a lot of times there are newer options. And these pets had great quality of life during their, which is the most important. We talked about live longer, live well, right? If they're not living well during treatment, I'm not doing a good job. So they really have to be living well and I want them to live longer as well. Okay, so finally, as we wrap up, just being proactive with your pet's health. We talked about looking for all of these signs regularly. Regular wellness exams are so important. In my opinion, as your pets get to middle age and older, they should be going to your vet twice a year. And people often say, well, that's really frequent. Think about how quickly, unfortunately, our pets age. That'd be like me or you go to the doctor every couple of years. So I really think it's an opportunity not just to talk about these signs of cancer, get a good physical exam, and monitor their body weight. And again, feel for lumps and bumps, mark them down on your skin maps, and use your pens. That's our top 10. Just want to give you a couple of resources. So on my Facebook page, in the album section, for the last year, we've put together these infographics on common cancers, and you can go through and look at all of the different albums. So again, you want to go to the photos and the albums. I can show you where they are at. So again, these are things that we have on common cancer. So if you're curious about dog lymphoma, cat lymphoma, bone cancer, hemangiosarcoma, skin cancers, mammary cancers, those are the ones that we've done so far this year, and you're more than happy to share these. I tell vets to post them on their social media page as well. And then I have a YouTube channel that I just started. So I have top 5 medications to prevent chemotherapy side effects. So if you have a pet that's going through chemo, these would be things that I would suggest that you go home with to minimize side effects. And then one of my favorite ones is the myths and misconceptions, because again, so many people are so scared about cancer. And if any of you have treated a pet with cancer, did you have a friend or a family member say, "Are you crazy?" Yeah, so often we do that. So it's really nice to be able to tell them how well our pets do during treatment and after treatment as well. That's for veterinarians. And then that was the code in case you want to sign up for the newsletter. I'll leave the top 10 up. If you have any questions, that's it. Yeah.
I have 2 of them actually.
Sure.
Going back to 8 with the urinating,
Mm-hmm.
my dog right now is like spotting more than once at a time, or 20 once. Do you think something I should bring him to the vet for?
Yeah, so that would be straining to urinate. So a lot of the times they can void their bladder, but then, and again, it could be cancer, it could be a urinary tract infection, but that irritation is usually what causes them to strain.
He's 21 months, so he's probably the UTI.
Yeah, hopefully.
And then just with the bleeding and discharge, kind of with the defecating a little bit, if they're constipated, can't they have a little bit of blood in the stool too?
Yeah.
Okay.
Usually there's a reason they're constipated though, right? So cats often get constipated when they're dehydrated, but why are they dehydrated? So is there something else underlying going on? But yeah, definitely the constipation can cause that, but then the question is, why are they constipated? Chewing fleece blankets would be an acceptable answer. Yeah?
This is a dumb question.
No questions?
When you aspirate,
Mhm.
you're sticking a needle into what I'm assuming is a discrete body. It doesn't release the cells that it does.
Not a dumb question, it's one of the most common questions I get. So the question is, when you do the aspirate, does it cause it to release or spread or anything like that? It does not. For mast cell tumors, which are one of the more common malignant skin cancers that we see in dogs, when you stick a needle in it, it can cause histamine. That's the stuff that makes our nose run, right? If we have allergies and stuff, that's an inflammatory mediator. so it causes inflammation. So sometimes if you stick a mast cell tumor, it gets bigger and redder just because you've released histamine locally, but it's not releasing the cancer cells. So that's one of the myths that we try to dispel. So it doesn't cause the cancer to spread. It's a good question, I get it all the time. I'm glad you asked. Yeah?
In what percentage of the cancers are visible in lump and bump category?
What percent of
All
lung?
the cancers, like would I assume that you could detect cancer in your dog 30% of the time through a lump and bump, or is it 90% or?
So it's estimated that about 25 to 45% of cancers are, this is the hard part, that are submitted to labs are from the skin. But I don't know that we can say that skin cancer is that number. So you have to remember, not everything goes to a lab. In people, cancer is a reportable disease and we have a census. So we know like the cancer incidence is tracked by gender and race and all these other things, and they send out reports that really tell us cancer type and by different age and things like that. So that's a hard question to answer. So it's estimated that bone cancer is about 5% of cancers that we see. But those numbers are hard, so I don't know that I could specifically say what percent. But of samples that go to the lab, skin masses are usually about 20 to 45% of the samples that go to the lab.
I don't mean skin, I mean lumps, like all of the lumps you were talking about.
I don't know that I know that number exists. Because that includes lymphoma as a lump, mammary cancer. So mammary cancer is number 2 and number 3 in dogs and cats of the most common cancers. So that would be a great number to have. I wish I did. Yeah.
I have two questions again. So I know that so vaccinations, doing vaccines, I know can sometimes cause sarcoma, and they do it in the leg because then they could easily amputate the leg.
In cats, yep.
In cats. But now the question is, I foster and I also have my own foster family tripods
Mhm.
of my own, and they have their front, they all somehow tend to have their front right leg amputated. One of them has their back. Then I think to myself, when they have their back vaccines, if they had one of their back legs amputated but they have a front one missing, does that mean that when you have tripods like that, does that slighten, like lessen their lifespan or chance of not being able to make through some like cancer if that happened? Because
I mean,
you know what I mean?
I think I know what you mean, but I think it's a difficult question to answer. So the incidence of vaccine-associated or injection site-associated sarcomas, which include vaccines, which are the most common injection that it was associated with, is 1 in 10,000 is what most studies say. So it's pretty uncommon that it's going to occur, but what I think is important when we vaccinate our pets is evaluating what do they need, right? And so if you have an indoor-only cat, they probably don't need feline leukemia vaccine. So I think it's really important to talk to your veterinarian about which of the vaccines that I need. There have been studies where they've looked at giving vaccines in the tail, or that was one of the sort of unofficial recommendations, is giving the tail because you can amputate a cat's tail. Not always approved, but again, these are things that you could talk about with your veterinarian.
And then my other question was, I'm a crazy mommy, and I brush all my pets' teeth.
Mm-hmm.
And how you said with the bleeding of the gums, I know that since I brush their teeth are much stronger, their gums are healthy. So does that mean that brushing them also helps prevent them from getting cancer, or is it just also good because then I can just keep an eye out?
I think it's just keeping an eye out. I don't know that we know that brushing teeth, I don't know that there's an associated with bad dentition and tartar and oral cancer, but I think it's great just for other health reasons to, I know. I don't brush my pet's teeth, so don't judge. All right, we'll do 2 more and then we'll let you know other people are gonna wanna go, and I think there's a few giveaways as well. Yeah?
Our yellow lab, 9 years old, recently diagnosed with T-cell chronic lymphatic leukemia. And her lymphocyte level is going up continuously. And I was referred to touching the virtually, and I thought that they would initiate chemotherapy. But they said that they don't initiate chemotherapy unless the lymphocyte level is extremely high, like 60,000. And right now my dose is about 9,000. In a human being, if they had cancer, the doctor would initiate chemotherapy in a rat try to eradicate the cancer. But these people seem to want us to keep it going until it gets very bad. Why in cats don't they give
So-
the dog chemotherapy right away?
So-
instead of giving cancer?
So he's asking about a form of leukemia, which is cancer that's originating in the bone, but it's leukemia, so it's of the lymphocytes, which is one of our immune system cells. And so, interestingly, I have 3 pets right now that I saw in the last 6 months, or the last 6 weeks for chronic lymphocytic leukemia, just like yours. And it's a very uncommon cancer, but again, sometimes we just see good amount of it. So, as an oncologist, I was always trained early detection, get on top of it, treat early. But newer studies in the last maybe 5 or 7 years for chronic lymphocytic leukemia suggest that early treatment does not improve survival times or have them live longer. So 9,000 is actually not that high, and I would agree. Again, this is just a general comment with I can't make specific recommendations about your pet, but in general, 9,000, most oncologists would not initiate treatment. I usually use about 40,000 as my cutoff. Some people do 50 to 60,000. Again, that means that there is not a consensus. There are other things that we look at. Are other cell counts low? Are they anemic? Are there other cells that need in the bone marrow, like platelets, low? If we're not seeing those other things, if it's not infiltrating the internal organs, we do often take a wait and see approach because, again, putting them on chemo early, they're not going to live longer. So you want to wait till a certain point, then put them on chemo. I know it's scary. Trust me, I know it's scary because it's been a shift in the way that I was trained over the years as well. But again, close monitoring, and then, and it's interesting, I've had one of the dogs that I told you I've started, he had to start treatment because his numbers went up and it started to infiltrate the other organs. And then I've had dogs that I followed for 18 months before they needed chemo. Okay? And I'm not afraid to give anyone chemo when they need it.
If a dog has like a mass that's been aspirated, and it's fine, it's just fat, can they in the future turn, to a cancer?
Yeah, so the question is, can a benign lipoma transform and become malignant? In general, no. I can tell you every once in a while, we will have something that was aspirated as fat, and then maybe, the fat around it was aspirated. So again, that's where I think it goes back to, so in general, lipomas don't transform and become malignant. But if that thing that was aspirated as benign is growing, you're measuring it, you're keeping track of it, and it's growing quicker than we think, it's gained a centimeter in the last, month or two, then you're gonna go back to your vet and maybe you wanna have it re-aspirated, biopsied, or something like that. But in general, lipomas are not one of the ones that transform. That's different than some of the internal. So cats with IBD, like my Jeter, that is a cancer that IBD can predispose them and can then transform to low-grade lymphoma. So there are some cases where chronic inflammatory conditions can transform to cancer, but not benign lipomas. But again, if it's not behaving like a benign thing, go back to your vet and talk about additional diagnostics. Okay? Because, I have seen ones where the original aspirate or the original biopsy suggested something benign, and then it doubled in size in 6 months and turned out to be malignant. So again, in general, aspirates will be very accurate, but again, you can't just say, it was benign, I don't care that it's getting bigger.
Can they have it for years though, before it even doubles in size?
Lipomas?
Yeah, like, so they have a mass, like I've had an animal who, they've had a mass and, I've had it checked and stuff, and it was fine, and then all of a sudden it just blew up and got hard and just like out of nowhere.
They can get infected, they can, other things like that. So again, if it's changing in size or appearance, then it's time, and it's been aspirated something benign, then it's time to go back in and reinvestigate and just make sure it's what we think it was, or that there isn't something else going on within it. Every once in a while, I will hear about a lipoma that when it was removed, they saw a small mast cell tumor within it. Those are the really weird stories. So, there are always going to be exceptions to the rule. So I think, again, if it's not, if it's getting bigger, it's time to reinvestigate. And again, I'm not saying anything that's benign should stay on. It may be that you're just not going to get it off this month. You're going to wait for the dentistry in 2 months and then take it off. And always have it submitted to the lab. Always, always, always. Even if it was aspirated as benign, always submit it to the lab for that biopsy. Any question?
One of my cats, I think Brian for, I think it was a respiratory, and I got to the
in general, well, then we're gonna wrap it up, because I don't know if everybody wants to hear all the, and I can do questions on an individual basis, but in general, thyomas that are completely removed surgically have a good prognosis. Submit it to the lab. Everything that's taken off your pet should absolutely always be submitted to the lab for biopsy to confirm it, okay?
Way in the back. We had a client that had a golden propensity to get lipomas and did aspirates lipomas, started getting a little bit bigger, which they can get. And another aspirate was seemed to be adipose or lipoma tissue. Get a little bit bigger, good client, so let's do another one. A couple months down the road, it ended up being cutaneous hemangiosarcoma. So like you said, don't get complacent if it's changing.
Yeah.
I think something that's totally different.
Yeah, so I think it's really important, and in the lumps and bumps lecture, I talk about a cat that had an aspirate that was suspicious of sarcoma, and then the biopsy was benign, and everybody was really happy, but that was the cat that I showed you on the scale with the big tumor over his lumbar area. It got bigger, bigger, and bigger, and everyone said, oh, it's just benign, but it turned out that it was a malignant cartilage tumor. So again, that's where I think it's important that you're measuring. And guys, my own cat lost a lot of weight right before my eyes. It's really hard to keep track of sizes and weights and things like that. We have to measure things. We have to keep track of their weight. But yeah, if it's growing, that's the time to biopsy it again, or get it off and and make sure. But if you're taking something off and you don't know what it is, you have to assume it's malignant, because we really want to make that first surgery the only surgery. You don't want to send them back. Not only is it for the better of our health of our pets, it also will save you money if you're only doing one surgery. So do that biopsy, do that aspirate before, and then have one big surgery. All right, let's I know you want to give away some stuff, and then I'll be around